Yeah, good evening all and a very warm welcome to all the participants. My name is Srinivas and I'll be the host for today's webinar. Joining me at the other end is the presenter and the subject matter expert, Ms. Anshu Bhargava.
Good evening.
Let me just give you a brief introduction about Anshu. Anshu is an MS in Quality Management from BITS Pilani. She is a postgraduate gold medalist from Apollo Institute of Hospital Administration, Hyderabad. Ms. Anshu Bhargava is currently a consultant in one of the leading hospitals in Hyderabad. A thorough healthcare professional with more than 14 years of experience in administrative, academic, and consulting. And she has worked in the hospital industry in various reputed corporate and private healthcare organizations. Specific to the healthcare industry, Ms. Anshu Bhargava has vast experience and insights in the area of strategic management, human resource management, training and development, hospital services planning, quality, management education, research, to name a few. She has won several accolades on presenting papers as a speaker in national conferences also. To keep the webinar interesting and interacting, I would request all the participants to keep asking relevant questions so that we all enjoy the webinar.
Thank you, Mr. Srinivas, my privilege.
To start with, healthcare, as the webinar name itself goes, careers in healthcare management. Now, healthcare management is the most sought after profession in the current industry, and why not? In 2015, the Indian healthcare sector became the fifth largest employer and one of the fastest growing sectors or industries. See, as per the National Health Policy 2015, current healthcare organization or the healthcare segment in private sector stands at USD 40 billion, and it is expected that the number would go up to 280 billion by 2020. And a lion's share would be in the hospital segment. So the demand for healthcare would grow, for healthcare management professionals specifically, will grow tenfold by 2020. Now, Ms. Anshu, keeping this in mind, you have been in the healthcare segment for over 14 years now. So I'm sure all the participants in the webinar would certainly like to know why the numbers would increase tenfold by 2020. Over to you.
Sure. The healthcare management actually both is an art and science, needed specifically in healthcare to help optimize certain infrastructure resources, deliver services within a stipulated time period at a minimal cost of a specific quality. So following could be some of the reasons that could explain the possible tenfold rise in demand for these kind of management professionals by 2020. The first one could be the growing burden of lifestyle diseases. We are all very familiar with the kind of challenges India is facing and has to a great extent, won the battle against certain communicable and infectious diseases, but yet is coping with a sizable burden of some diseases even today. The burden of lifestyle diseases is expected to grow from 50% in 2011 to around 81% in 2020. If we just take two common lifestyle diseases into consideration, for example, diabetes and hypertension, we currently have about 65 million diabetic patients and approximately 180 million patients who are hypertensive. These numbers are only expected to increase, possibly as much as 50% in the next 5 years. So changing demographics, disease profiles, and the shift from chronic to lifestyle diseases is resulting in increased spending on healthcare delivery. There is thus a need of skilled healthcare management professionals with commitment to address this today. Moving on to the second possible reason is the growing investment in health and hospitals from the private sector. With a growing requirement of additional about 6 lakh to 7 lakh beds in the next 5 years, the private sector is poised to grow at a CAGR of about more than 40%. It's a major sector stimulating economic growth and employment in the country today, undoubtedly. The growth of the sector is also bringing about focus on implementation of quality platforms like NABH and JCI to ensure patient safety and compliance. With private players entering the healthcare industry, the demand for efficient health and hospital management professionals are just bound to go higher. Let's move on to the third reason: growing number of public-private partnership projects in healthcare. Growing concerns of quality and effective healthcare has resulted in the growth of PPP projects, that is, public-private partnerships in healthcare. Since provision of healthcare is the primary responsibility of the state, PPP platforms provide a unique solution with high level of commitment from private players with financial support from the government. As per the India Vision 2020 report, physicians, nurses, medical technicians, apart from them, hospital managers and other scientific occupations will become growth industries to rival the IT sector within the next decade. Talking about IT, growth of technology usage in healthcare industry is another very critical reason. In the service sector, the benefit of IT, that is information technology, could be the biggest in the healthcare sector after financial services and the education sector. Telemedicine is growing faster in India. The telemedicine market in India could grow from 7.5 million US dollars to around 20 million US dollars in the coming year itself. Information, communication, technology is changing the entire landscape of healthcare. Healthcare today is becoming more personalized. If I have to say, people can now shop for health insurance online, they can renew prescriptions online, they can request medicines from their smartwatch, they can receive real-time text alerts on vitals like BP if it is too high or low, and they can also view test results and receive electronic consultations. So with health IT product implementation and sustainability being the major challenge, a pool of healthcare management professionals with strong training in health IT would be critical in the years to come. Fast-growing health insurance sector cannot be ignored. India is the second country after Russia to have maximum percentage of out-of-pocket expenses for healthcare, with around 85% of OOP expenses incurred today. And given the rapid growth of the hospital sector, the volume of health insurance is bound to grow. Let's talk about medical tourism. Growing avenues are currently visible even for medical tourism. Medical tourism is fast emerging as one of the most lucrative investment areas in the country today. Medical tourism market is around 2 billion US dollars per annum, and in the next 4 years, we may see the market growing more than 4 billion US dollars per annum. So this would certainly increase the demand of skilled management professionals. Not to say the minimum or the least, India is becoming a land of growing older population, geriatric population. So the population is fast aging. The growth of old age population is expected to reach around 100 million by 2020. And so also the demand for home healthcare. So a spurt in home healthcare would see a growth in demand for healthcare management professionals, which is visible even as of today.
Thank you, Anshu. I think you have summarized the growth drivers and the opportunity that exist and that are awaiting for healthcare providers, and you have summarized it in a nutshell. And I'm sure all the participants who have just joined us, they are hearing to Ms. Anshu Bhargava, who is the subject matter expert on healthcare management. And now let's move on to the next question. Now, these opportunities in the healthcare segment, this leads us to another question: like, what does someone in healthcare management do exactly? I'm sure all the participants are very eager to know about it.
Sure. It's like this, from ensuring that the corridors of a hospital or a healthcare organization are sparkling clean, to keeping life-saving machines in working condition, to attending to the patient's complaints and catering to their various needs, the hospital administrators are performing multifarious tasks. Hospital healthcare administrators, they impact the lives of many people by simply ensuring smooth running of the healthcare organization's activities. It could range from planning to finance to personnel management to purchase to supply chain to even building maintenance or the organization of facilities like laundry, catering, cleaning, wherever necessary. Healthcare managers, they aim at efficiency with cost effectiveness, improving operational efficiency with focus on enhancing the overall patient experience. Healthcare management equips professionals with knowledge to plan, direct, coordinate, and control the various activities of healthcare organizations. Not only that, they also help and are trained to manage the complex relationships between patients, physicians, hospitals, insurers, and government agencies. Therefore, careers in this field, they require professionalism, leadership skills, and understanding of the complexities of healthcare delivery with its specialized language, financial structure, and of course, the policies.
Great. Uh, do we have any questions from the audience from what we have spoken till now? Any questions from the audience, please? I'm asking you for the questions at this point of time so that we are all on the same page. And if you're all on the same page, we can move forward. Can we have a quick yes or no from the audience? Can somebody type yes or no if you have any questions at this point? Great. No. Okay, fine. I think so far there are no questions. So we'll move ahead now. Now this leads us to the question as to why should someone pursue, I think we have looked at it. What are the career prospects in this field, Anshul?
See, these are exciting times for those opting for a career in healthcare management. The healthcare landscape, we are all aware, is changing rapidly almost every day in terms of how and where care is delivered, who is providing those services, and how that care is financed. Healthcare management requires talented people to manage the changes taking place. In their roles, these healthcare executives, they have an opportunity to make a significant contribution to improving the health of the communities and the organizations they serve. So with growing diversity in healthcare systems, as we have just addressed in our earlier questions, executives are having tremendous opportunities in healthcare today. It could be in terms of clinics, it could be in terms of consulting firms, health insurance is a good opportunity. You have hospitals, of course. Apart from that, home health care, rehab centers, skilled nursing facilities, and not to forget but mention the universities and research institutions. So there's tremendous opportunity for a person wanting to pursue healthcare management.
Great. Now, any questions from the audience so far? Yes, I can see Ravindra Prabhu, Jolly Gandhi, and Dr. Ruby, who all joined us. Do you have any questions for us at this point of time? Great. So now moving on. Now, how does one actually become a healthcare professional? Suppose if one of the participants who have joined us in the webinar, they are really looking at this webinar and thinking of becoming a healthcare professional. So what exactly they have to do? How do they go about it?
See, becoming a healthcare management professional is all about aptitude and passion. To enter this field, you need to be just very optimistic, very proactive in your approach. Yes, strong written and oral communication skills are a strength. The ability to develop and present reports, talent to work well with others, interpersonal skills, and honest and ethical conduct in a place like healthcare where we are dealing with life, and significant leadership skills, including tact, diplomacy, flexibility, presence of mind, is what is critical. A formal qualification and training as a diploma or master's in hospital or healthcare management is certainly helpful and beneficial in understanding the intricacies of healthcare management. So what I would suggest is, yes, you have your soft skills, you have your interpersonal aptitude, passion, but a degree supporting that and insight on how do we go about delivering care scientifically, academically will make all the difference.
Yeah, great. So Anshu, you have been associated with Medvarsity as a faculty over the past 3 to 4 years. So what do you think that the courses which Medvarsity runs, like the Diploma in Hospital Administration or the Executive MBA or the MBA in Healthcare Services Management, how far they can help in helping a person in taking this forward and becoming a good healthcare professional?
Sure. I've myself been a student of hospital management years back. And what I found very interesting and positive about Medvarsity and its course in health and hospital management is that the course is very well designed, balanced with classroom study and related case examples and activities. The effort that they make to get the appropriate experienced faculty from the industry is very encouraging. Flexibility of working while studying, very helpful. And what I also found in the last couple of years is the students that are joining this course are very mature. They are coming from varying work experiences and backgrounds. So there's a lot of knowledge sharing in the forum when we connect with the students. And most importantly, there is an advantage of a hospital access for live projects and better informed learning. So whatever you're actually studying in books, you're actually doing it live as projects in the hospital. So I certainly find the course offered by Medvarsity very helpful, meaningful in healthcare industry.
Yeah, I think going back to one more question, I'm sure, I think this question, I'm sure, definitely will be there on the minds of all the participants, that why should someone pursue a career in healthcare management and why not something else?
See, it's like this, and I'm being quite blunt here, that you have all your regular MBAs, you have your general MBAs, but for somebody who's possibly already in the healthcare field, or possibly already a healthcare professional by way of pursuing their BDS or pursuing their MBBS, and then wanting to look at a possible change in their career, or for those who are having a passion for health, for helping mankind, for connecting with the health side of the industry, this is the course that you need to follow. I mean, this connects with you, and the sky is the limit. It all depends on how you align your passion, your aptitude with what the industry has as an opportunity to offer. So it could be as varied as just working in a hospital, connecting with patients one-on-one. It could be as varied as working in an IT firm and connecting and providing healthcare through technology. It could be helping in improving the accessibility of care by connecting with insurance companies or with clinics, or it could simply be connecting with universities and teaching institutions to nurture even more health industry we are working on today. India needs many more such healthcare professionals, given the kind of challenges and burden I had expressed earlier today.
Good. One more thing, one question, one pressing question, which I wanted to ask you. I think everybody is having the same question. That every year you see a large number of students passing out with a degree in hospital administration or healthcare management. But do you really think they are industry ready, or they lack in the required skills? And where does Medvarsity fit in the picture?
See, that's precisely the point. I have been connected with many such institutions, and me being a student myself 15, 20 years back. What we are worried is lacking in the upcoming graduates is that there's a need for a sense of maturity. There's a need for a sense of passion. There's a need for a sense of an aptitude towards healthcare. Very clearly, if you are not connecting with the essence of serving, the essence of health and a sense of saving lives, then healthcare management is not for you. So it's as simple as, we as professionals in healthcare today, if I have to work in my own hospital, we have to have that kind of potential, aptitude, passion, that yes, this is what we would like to do, and then skill sets develop on their own. So there, when I look at Medvarsity and the kind of years I've spent with the students here, I found that that maturity is in them. Most of them have come with past experience, or they have joined this course with a specific focus in mind. So they're already aligned with what they would like to do in future. So that's number one. And once that alignment is, this course is, as I mentioned, it's so beautifully designed and balanced that it connects with the student where that student would like to align itself in its career. So be it technology, be it HR, be it finance, they bring in such kind of faculty and professionals with that kind of experience, so that the solutions the students are seeking as part of this course gets answered with through this Medvarsity course. So there I found a lot of fulfillment even as a faculty, because I could connect with the students, I love their passion and aptitude and their curiosity, and very fulfilling, because at the end of the day, we want such professionals to come back into the industry and we hand over the baton to them. So it's all that forthcoming with the Medvarsity and encouraging.
I think there's one more question which I wanted to ask you. A large segment of students who join our courses, especially the hospital administration, the executive MBA, as well as the MBA in healthcare services management, are dentists and BBS graduates and doctors in the alternative medicine. So, how do you see doctors and Ayurvedic, the alternative medicine doctors and the BDS graduates? I mean, how can they make a career in the healthcare field or the healthcare segment?
It's like this. They already have an added advantage of being, of clinically being informed. So the bridge that we generally, as non-clinical students, I myself am a non-clinical graduate. So for us, it is very difficult to bridge the kind of gap which we may unfortunately have with senior doctors and consultants in the healthcare industry, right? So when we are already clinically informed as BDS, MBBS, or Ayush doctors, that particular challenge is kind of bridge. So when we look at quality initiatives like NABH or JCI, we have certain clinical parameters that we need to kind of comply with, right? So there, I have found that those executives or healthcare management students, clinically informed, they are very, very resourceful in helping us deliver and bridge that gap between non-clinical and clinical to that kind of language in optimizing resources, delivering the kind of service the hospital wants, and yet meeting the expectations of the patient. Okay, so the doctor, as doctor, he's very busy handling patient care, clinically taking care of patients. So where there's a mismatch, say in terms of equipment, in terms of manpower, in terms of skilled labor, in terms of training, these kind of hospital clinically informed executives bridge the gap. They come in, they bring in that kind of an advantage, and very much necessary in hospital and healthcare management today.
Good. Thank you for making that point, Anshu. Now this comes to the next question as to, see, once a student finishes either his MHA or DHA or the executive MBA, and when he steps out into the market, now he expects a good remuneration or a good salary. I think everybody is thinking of it because he thinks that he has put in a lot of effort and hard work in finishing his studies. So what exactly is the situation out there in the healthcare segment as compared to probably the manufacturing industry or some other industry? What are the kind of salaries which the service sector or the hospitals offer?
A very good question, and I keep getting these questions from so many students whom I connect with and teach. And I just have to say one thing. Okay, for the beginners who have just joined this course immediately after their graduation or postgrad, it will take some time for you to set into the industry. So do not expect the moon right from day one of you joining a hospital. What is it that you can give the hospital the very first day of your joining? So it will take at least 1 to 2 years for you to build that kind of a financial revenue that is deserving your kind of potential and capability. So to start with, I would look at, if you're joining a hospital or a health industry and it's a general setup, then maybe 4 to 4.5 per annum would be what I would look as reasonable. It could be 3.5, it could be 4.5. It all depends on whether you're joining a corporate, you're joining a trust, you're joining a private setup, you're joining a government hospital. But if you're already coming with experience, then it's a very different matter. Then it depends on what is the kind of skill set you're coming with into the hospital, what's the kind of potential and alignment, and what is the need of the hospital to fit you into that kind of sector. So if I need a vacancy in HR and you're already coming with some past experience in HR, then well, whatever is the remuneration you quote, it is negotiable. But for beginners who are entering into the course, let's not start looking at 5-6 lakhs right from day one of you joining the hospital. I would not look at you really, all that forthcoming and deserving that. Get into the industry, give yourself 1 or 2 years, invest in yourself to that extent of, in terms of exposure, in terms of experience, and then sky is the limit. So trust me, it's just a matter of you aligning yourself with the needs of the hospital. The moment you do that, that's it. You have won the heart of the hospital and you grow.
Yeah, I think thank you for answering this question, because I think most of us had this question in mind, and thank you for clearing those doubts. One more question which comes to my mind at this point of time is that there are a lot of IT companies apart from hospitals and other healthcare organizations which hire people who have done their executive MBA or hospital administration, or people who are connected with healthcare. So, do we really have that kind of jobs in these IT companies?
Yes,
Also?
certainly. Certainly. As I told you, that one of the critical reasons that we are looking at a lot of need for healthcare management professionals in the coming years is the growing spurt of technology. However, again, my take in this is that for a fresh student of BCom, BSc, any kind of a graduate who is not exposed to a hospital, my first take would be join a hospital, join a clinic, join a healthcare organization for the first 1 year, just to dirty your hands, understand what is healthcare and hospital all about. And after that, get into technology. So you're more focused, you're more aligned with what are the specific processes of healthcare today and how can I digitize them and where can I use technology. If you join a IT sector right from day one and you have no idea what a hospital is all about,
Yes.
then I'm sorry, you may, seriously feel they're not part of it. I've faced students where they've got the best of packages, they've joined the IT firm, and they're on bench because they just don't know what they're meant to do out there, and how is it that they can connect with what they have learned and what they are expected to deliver. So
Exactly.
come to a hospital, join a hospital, and then of course, and those already with a background, already clinically informed in healthcare, yes, you can literally jump into IT right from day one, and you have tremendous opportunities to grow further in your career.
Wonderful. I think people who had this question, I think, what about the opportunities in IT? I think Anshu has made it pretty clear that there are huge opportunities in IT, especially like I think she herself has worked in Tech Mahindra. If I'm not wrong, Anshu, she herself has
Yes.
worked in Tech
So,
Mahindra.
but yeah, but it's just that, and I'm bringing that point also across. It's how you align. See, you have joined this particular course, and I believe you're going to join this course because you have a passion and alignment to it. You're not just joining it for a career in terms of money and remuneration. So, say my passion is healthcare. So I did join IT just to understand after 13, 14 years of experience, let me have this feather in my cap. But not with my passion in healthcare. I would rather serve the industry, connect with patients, interact with patients. IT sector was not for me. So while I got the best of opportunities, the best of careers, I didn't feel myself aligned and I had to come back to a hospital sector. So at the end of the day, you need to understand and use this 2 years of your or 1 year of your course, postgraduate course, to understand where your interest lies. Test try, you can connect, do some projects in the IT industry, do some projects in the hospital, see where your alignment is, where you are interested in, and then take it up as
Yeah,
a career.
I think taking this forward, there's a question from Jolly Gandhi, who is one of our participants. And as you can see from the chat box, she has asked, how will healthcare help in IT?
Yeah, so that's where I talked about. See, when we talk about IT, and I've mentioned reasons even earlier, we are talking about things like Internet of Things. We are talking of things like wearables. We are talking about, technology where the patient is so well informed that you really don't need a mid person. So where do we come in as healthcare management professionals? We bridge the gap. What is needed from the hospital side and what is technology having to provide? That alignment is where we come in as resource people and as consultants. So, say you have some specific city or some specific country wanting to start a blood bank. right? And the IT firm where you are working in is having all the technology that can help you drive and digitize the setting up of a blood bank. So you come in as a resource person and say, look, this is what the blood bank is needing as part of technology. And we tell the blood bank people, this is the technology and this is where you can align it with your process. So we bridge the gap. So that's where we primarily play a very big critical role. And that's where I'm saying that unless I'm clear on my processes and my standard operating principles or documents, I cannot bridge or bring in that kind of alignment with technology.
Great. Yeah. I think there's one more question from Ravindra Prabhu. Will Medvarsity provide certificates each semester, because some colleges provide it at every semester? Ravindra Prabhu. Yeah, I think moving forward, I think now I think participants, I would love to hear some questions from your side. I think Anshu is waiting for all your questions so that she can answer you directly. So I want you to shoot questions now. Or if you have any other things which you want to clear up right now, I think Anshu is a subject matter expert right now who is there to help you out. So let the questions keep coming.
There's one where you have mentioned about how will we be exposed to any career opportunity, right?
Yes.
Through online job portals, etc. See, one thing which I wanted to express, and where you all have more of an advantage rather than what we had as students 15, 20 years back, is the internet. So kindly stay updated and be as knowledgeable of what's happening globally around the world. Do not limit yourself to only the academics and what placement opportunities Medvarsity or any course or college will offer. How will you be exposed? By your own efforts. Understand what are the opportunities globally around, where is it that you can fit in, what would be your market value, and the value add is that yes, Medvarsity possibly could help you in your placements. But finally, you get exposed to career opportunities by exploring, and internet is the best option.
Yeah, I think coming down to what Medvarsity is offering to bridge this gap now, Medvarsity is offering 3 courses to its students. One is the postgraduate diploma in hospital administration, which is a 1-year course and comprising of 4 modules, and it has a mandatory project apart from a 2-week contact program, which Anshu was speaking about, that how well and how clinically it is organized. So, and how it increases the peer knowledge and how the interaction happens during the 2-week contact program, and what kind of students she gets and how well she enjoys as being part of the program. So that is a little about the postgraduate diploma in hospital administration. The another program we have is the executive MBA in healthcare management. This is also a 1-year course which includes 4 modules. I think I'll just open up this. Yeah, and coming down to the executive MBA, as I was telling you, it's a 1-year course with 4 modules, and it also has a 2-week contact program. But since this executive MBA is for already people who are already working in an hospital and they are usually busy, so we do not have any project work for them, unlike the diploma in hospital administration course, where we have a mandatory project apart from a mandatory 2-week contact program. The 2-week contract program is not mandatory for the executive MBA course, since we wanted to give some flexibility to the students who are joining this course, because they are already working in a hospital. We have the contact program in 8 centers pan India, starting from Hyderabad, Delhi, Bangalore, Bhubaneswar, Bilaspur, Indore, Ludhiana. So we have 8 centers where we have the contact program. We run the contact program of 2 weeks. And as Anshu told you, this contact program is purely a case study based contact program where a lot of interaction and networking happens. So this is not to miss a contact program for the students who enroll this program. And the third program, which I want to talk to you, is the MBA in Healthcare Services. So this is a 2-year program, which is divided into 4 semesters. And now each year you will have, at every 6 months, you will have 1 semester. So a total of 4 semesters. And this also includes a 2-week compulsory contact program for all the students. And all the examinations for all these courses will be online. And you can give these examinations from the comfort of your home. And all these examinations are online. And apart from this, as I said, the only time where you come into contact with the faculty is during the contact program time. So, and apart from that, you will have regular support in terms of project management and all, where you have to get some help for making the projects and all. You will have full support from the customer relationship management team, as well as the program management team as well. This is just a brief about the various programs which Medvarsity offers. And I can see one question here. I am a nursing superintendent doing advanced nursing management course for 6 months. How it can add value in my career? I think this goes to the subject matter expert, Anshu.
See, it's like this, and it's a good question. You yourself, Ms. Juliana, would be facing challenges as a nursing or superintendent in managing administration, right? But in terms of resources, that could be, your nurses. How do you schedule them? It could be in terms of the consumables, the kind of care you're delivering to patients. So when you do a course like this, automatically from a nursing superintendent limited to the nursing care, you move into becoming a healthcare professional, not only limiting yourself to nursing, but looking at the overall umbrella of administration and management in a hospital. So it could be, as simple as what I was talking about, clinicians joining hospital management or healthcare management to help them run their businesses and hospitals. You would add tremendous value in terms of your clinical knowledge, and nursing itself being one of the bigger strengths of human resource in a healthcare sector. If you come to know the various small little nuts and bolts of management and administration, imagine what you could deliver as part of training your little juniors, your nurses, and transforming the delivery of healthcare in your own hospital. So you would better understand what your managers are expecting of you. You would better be able to bridge and help them, and support them in their challenges in management, and not limit yourself only to nurses and the delivery of clinical care. So that way it would tremendously help you in your career opportunities.
There's one more question which we missed out, Anshu. This was asked by Loknath Patnaik. What his question was that I am now working in a health industry, which is the IVF marketing, in vitro fertilization marketing. How does it benefit me?
Yeah, it's like this. IVF is one of the niche centers. When we talk about neonatal care, we are talking about maternity, we are talking about cardiac. We are now getting IVF as coming in as, something which is growing and a small niche in itself. So when we talk about healthcare management and hospital management, I've myself consulted a upcoming IVF firm. You will face typical challenges in terms of managing resources, managing staff, trying to understand what is it that your patient is expecting or needing and how is it that you can bridge that gap and understand how you can utilize your resources, your services that you provide to so when we talk about IVF, we talk about healthcare management, we talk about marketing. Your healthcare management course will give you all the kind of strategies, will give you the insights on how best we can approach these kind of challenges and help better administer, manage such services in healthcare.
Yeah, thank you, Anshu, for that answer. I think I have a very interesting question right now. See, I'm Kaushik Srivastav. She has asked, Kaushik Srivastav, I'm a BDS working in my own private dental clinic. Will that be counted as experience, as it
Yes,
is not
ma'am.
under hospital or healthcare? So, I think very
Sure.
common, interesting question. How would you answer that? No?
Yes, and I would certainly say yes, that would count as experience from a clinical angle. So when you come to a hospital and you're joining a hospital management cadre in a hospital, yes, from the clinical angle, I will certainly take you as one who has come with some experience, with some maturity already, with an awareness that these are the possible challenges in running a small healthcare organization that you are of your clinic. So, given I would be in a better position of reassurance that tomorrow, if I make you an assistant manager or I make you an administrator of a particular vertical in a hospital, you will be able to deliver and take it from there. The only place where I would need some experience is from a management angle. How is it that you can, you are clinically, yes, a clinician, but from a management angle, can you actually manage this challenge? But if you're running your own clinic, you're already doing administration. You're already running your own clinic. You're already administering your own clinic. So that certainly amounts for a lot of experience, and that will come.
So, thank you, Anshu. I'm sure Kaushik must be satisfied with an answer now. Kaushik, you have to type a quick yes if you are satisfied with that answer. Okay. Now, there's one more question from Smriti Mishra. Now, she's saying that where are we usually placed after healthcare management having an MBBS degree?
It's like this. If we are talking about healthcare management, that is not hospital management, but healthcare management, then there are opportunities like one, the NRHM, yeah, which the government is very, very strongly, kind of talking about and is working on for a lot many years. In
Yes.
Telangana itself, we have Arogya Shri. That itself is a very good opportunity. Then you have Access Consulting firms. So you have a lot of public health related opportunities where you can drive in. You have things like government supported public private partnership research opportunities where you can bring in a lot of perspective. So there are huge opportunities. The challenge is, where do you fit yourself in it? Would you like to be on the ground in the villages, in the rural area, driving care? Would you like to be statistically a master, getting all the data, accumulating it, and then driving in trends, analysis, which help in informed decision making? So, where is it that you would like to fit in? And as a health hospital MBBS degree, well, you can join UNICEF, you can join CRY, you can join any of the WHO. They would love to have MBBS clinicians coming in with a healthcare kind of aptitude and passions. Anywhere that you would like to. So that's where, if you want to test, try and do small life projects. Connect with them, understand what they would like to do, connect with them as an intern. See where is it that you fit into that kind of an opportunity or umbrella, and then go.
Yeah, thank you. I think that was a very elaborate answer, and we got a quick thanks there. So, thank you, Smriti. Uh, as I said, Anshu, our diploma in hospital administration course, which we offer, has a mandatory project work. Now, what do you think? How much of help is doing a project will help in the future careers? Doing a project.
Oh, it would help tremendously. That's where, see, one thing, and that's when I tell all my students, the advantage that you have is you can make mistakes and you're just a student. So nobody will question you because you're a student in healthcare, right? So take this as an opportunity to test drive what is it that you would like to explore as a possibility in as part of your career in healthcare. So say you are an MBBS doctor or a BDS and you are interested to go into IT healthcare, right? So you can do a small little project in one of the IT firms and see, does it really match the kind of expectation you had of IT, and does it really match your aptitude and passion, or is it something where you're a misfit? So these kind of projects help you connect live, real time with what you joined this course for, and what is it that finally you would deliver and connect with as part of your career. So I feel you should take these projects as, good opportunities, take them seriously, and do them at places where you would like to explore and see, okay, does it fit you, or would you like to move on? So it's a very good opportunity, and you should take it up.
Great. I think Mr. Loknath has asked me the course fees for. I think this will help all of us to understand how much of the course fees of each course is. And I would welcome more questions from the audience, if any. I think till now, I think Anshu has cleared most of the doubts. But still, if you have any, I think I would welcome so. Before we can start winding up this session or move towards the end of the session. Yeah, any more further questions coming up? Yeah, I think one more question. How will the course will help in the health insurance sector, from Mr. Loknath again?
Yeah. So once again, when we talk about health insurance, there's certainly a spurt in that as well, because now, for example, in hospitals, we are looking at cashless facilities, we are looking at reimbursements, we are looking at, kind of providing that kind of credit facility to our patients, especially in terms of, when there's an emergency or when there's a totally unexpected need of care. So that's where insurance comes in. And once again, the insurance sector is not tuned in with healthcare. So once again, as insurance, you bridge in that gap. What is it that the hospital provides and what is it that the patient needs? Not only that, you are providing accessibility to care. So where is it that the economical structure of the patient fits into the kind of fee structure or tariff structure of the hospital, where he can derive care at minimum or cost effective manner? So insurance will help you in designing care plans, in designing opportunities or models that simplify the accessibility of care to patients and connect them to the right kind of healthcare providers in the industry today. So tremendous opportunities in health insurance. But once again, you need to know the hospital first, even before you connect with the insurance. Otherwise, there's a disconnect. So be clear on that.
Yeah, I think ultimately, I think what Anshu has told all of us, that if you want to get into any healthcare segment, the base lies in first you have to start doing or enroll in a healthcare management course to understand the intricacies of hospital administration or healthcare management. I think that is the first step if you are willing or interested in moving into an healthcare segment field. Am I right, Anshu?
Absolutely. I strictly go by that. I would recommend that. And you won't regret it. Trust me. It's the right way and the right foot forward.
Yeah, I think since there are no more questions, I think you have answered all the questions to the satisfaction of all the participants in the webinar.
There is one by a physiotherapist.
Yeah, okay.
Yeah, asking for suitability in joining a healthcare.
Yes.
Yeah. So should I go ahead?
Yeah, please go ahead, Anshu.
It's like this, and I've had many students who are physiotherapists, and they are doing brilliantly well as part of consulting firms, in home healthcare opportunities, apart from hospitals. The only thing where the disconnect is that my starting pay is not enough. I have done a physiotherapy, and then when I join, I don't get the right kind of pay. And that's where I keep telling people, just wait for 1 or 2 years. Invest in yourself and in the organization, and then that's the limit. So as a physiotherapist, you have tremendous opportunity once again, especially I feel in clinics, in chain of clinics, in home healthcare opportunities, and as well as consultancy firms. So you'll do well in all these.
Now,
I have that kind of feeling.
yeah, sorry to disturb you, Chair. So, thanks for that reply. And there's one very interesting question which even I wanted to ask you at the end of this is because you have been a recruiter yourself and you have taken in a lot of students also. So, does having a regular MBA over an online MBA matter, or what exactly does it matter when you are hiring a student who has just passed out? What is your hiring is based on what is that you exactly see in your students or in your prospective employees?
Yeah, it's a good question, and a lot of students ask me this question. And let me say one thing, at least as a recruiter myself, I'm not going to ask you what degree you have got. है ना? As long as you have a degree in healthcare hospital management, it brings to light that you have some insight on how do we understand management and administration and how can we deliver better healthcare. But whether you've done a master's, you've done a diploma, whether you've done an EMBA, that does not matter. It is what you're bringing onto the table in terms of aptitude, in terms of passion, in terms of experience, in terms of conviction. So if you're going to answer my question wrong, but you're going to answer it with that kind of conviction and passion, I will still take you on board. So it's all a matter of what is your kind of commitment, and let us put it this way: what is it that you have to offer, and that is needed by me, and that's where we can make all the difference. So it's not qualification. Qualification would matter if you're looking at a PhD program or for higher studies. That's when possibly a master's may count. But when we talk about careers and opportunities as placements, I don't see diploma or EMBA or distance education being different from your regular masters. I'm an example to that extent. If I have to say I've done my MS from BITS in quality, I've done it as an off-campus work integrated course. So while I did get a regular MS from the BITS University, it's very different from what I got as a master's in hospital administration. And yet, all I'm understood as is having done MHM and MS. So that really doesn't matter. It's what I bring onto the table as a personality that counts.
I think I'm sure you have answered this question. I think to the satisfaction of all the participants. I think all of them, I'm sure, had the same question in mind: whether the online MBA is any lesser than the regular MBA, or more opportunities, or employers give more preference to the regular ones. So it is only a myth, I think, as you have said. And
I believe.
So you have busted that myth, and we are all happy with that now. So all of you can, without any fear, without any issues with the employers, I think going for hiring regular MBAs, you can work at the same time, and you can at the same time study and do the executive MBA or the postgraduate diploma in hospital administration. So as she said, what matters is the attitude. I think you can always train for aptitude at a later stage. So it is attitude that matters. Am I right, Anshu? I think.
Yes, don't forget that. That's more important.
Yeah, exactly.
This adds value to it.
Exactly. So I think we have just time for 2 more questions. I think so. Let the questions keep coming. We are waiting for 2 more questions. Yeah, I think no more questions. I think all the participants are pretty much satisfied with your answers, and they're all pretty happy. And I'm sure, I think they'll take a quick decision maybe by today evening or tomorrow on joining these various courses which are being offered by Medvarsity. And I want to repeat it once again. We have 3 courses on offer for all the students who wish to join the healthcare segment. The first one is the postgraduate diploma in hospital administration, which is a 1-year course. The second is the executive MBA in healthcare management, which is also a 1-year course. And the third is the MBA in healthcare services management, which is a 2-year elaborate course based on 4 semesters. The postgraduate diploma in hospital administration, as I said, is a 1-year course which has 4 modules, 1 mandatory project work, and a mandatory 2-week contract program at 8 Apollo centers across India. The same holds good for the executive MBA contract program as well as the MBA contract program as well. And one more very important thing which I want to make it very clear right now is the contract program is not a regular contract program where the faculty will come, will open a PowerPoint presentation and will teach you. The contract program is purely a case study based contract program where all of you will be given a case study to discuss, and it will be discussed in groups and individuals, threadbare, and then you come up with your solutions. I think that is the type of teaching, or that is the type of pedagogy which we are using or running in the contract programs of Medvarsity classes. I'm sure Anshu right now sitting here will be party to that, because she herself teaches all her students through case study based.
Absolutely, I fully agree, and that's where there is real learning. After a particular time in life, that's how you connect, and there's more of knowledge sharing and connect in such initiatives. I fully go by that.
Okay, so I think now since there are no more questions which I can see on the chat box, I take this opportunity first to thank all the participants of the webinar. I think this has been one of the most interactive webinars I have seen so far, where I could see a lot of questions coming and a lot of answers being given in a satisfactory manner, and everybody is happy. And I once again take this opportunity to thank all the participants. Thank you so much for participating, and I'm sure you are clear in your minds now as to where exactly you have to take your careers, in which direction. And I think by the end of this webinar, I think I'm sure you will be able to make a decision as to which course you have to join. And last but not the least, thank you so much, Anshu. I think no amount of thanks is enough for you, because you have taken time out of your busy schedule to join us and share your expertise and knowledge with all of us on careers in healthcare management. And thank you so much once again.
Thank you. I wish all the students all the very best. Be my
thank you, and all the best to all of you. Thank you.